I want to hear a little bit about estrogen. Since we're talking about it, menopause, it's going to hit every woman who lives long enough. Some younger than others. There are lots of confusing issues out there. And I know that this is a big part of the bioidentical hormone treatment regimens that you do. Give us a little perspective on menopause, what happens when you lose estrogen production, which you just sort of described to us, but a little bit more systematically, and then how you approach replacing it, or if it is necessary to replace it. Do you take estrogen replacement?
I cannot.
You cannot?
I react very badly to estrogen.
You react badly
Yes.
to estrogen? Okay.
I end up having blood clots.
Okay, so you have a risk factor that prevents you from...
Correct.
From taking it. Okay.
Right.
But you seem to be coping with it okay.
Yes.
Okay.
Yes.
That's important.
Well, there's no doubt, estrogen has like 500 different functions, and there's no doubt that the younger a woman is when she loses her estrogen, for example, a young woman on chemotherapy having ovarian function knocked out, that woman will have accelerated atherosclerosis. There's no doubt that there's literature that clearly shows that there's an increase in dementia, Alzheimer's disease, chronic diseases. The only problem has been proving that giving back the estrogen is valuable in preventing those. And so that's really where the conflict is right now. And with that, we could spend hours really discussing it, but there was a large study done in the early 2000 range called the Women's Health Initiative using synthetic hormones in women that averaged age was 67 years of age, well past menopause. And in those years, we were giving hormones for preventative medicine purposes. And those two particular hormones that were used clearly do not prevent chronic diseases in 67-year-old women 15 years after menopause. But what the question is right now is when a woman is just at her menopause and has not been away from estrogens for many years, or hardly less than 5 years it seems, there's emerging data that there's a window of opportunity to get on to the estrogens and actually have benefit. But now what we need is another huge study to show this, and since we're talking about effects that could go for years and years and years, it's unlikely that we're ever going to see this study in a meaningful way that will help us answer the question. So, but right now we have to basically go on smaller studies and more expert opinion about what to do. Not all women need estrogen after menopause. Some women continue to make their own estrogen from other sources in the body, which is enough. But there's no doubt about it that there is a link between low estrogen levels and all sorts of degenerative changes in women.